There's some stuff from the fluid family if you want to answer one of those.
Let's see if we can find one of those.
Lovett had one about...
Oh, that's right at the very beginning, didn't she?
Oh, wait, let me get my timer out.
Okay.
Well.
Okay, well, what she asked was repetitive sounds annoy her. And this is a thing, and this is from Lovett, her name is also Patty. And this is an actual condition. It's called misophonia. And it's a disorder that causes people to have strong reactions to sounds and particularly repetitive noises. The miso soup is Greek for hatred, and then phonia is sound, so hatred of sound. And they may experience mild to severe reactions like anxiety, disgust, urge to flee. Now, there are some really serious cases where clock ticking or windshield wipers can anger and disgust people to the point where they get a fight or flight type response. Their adrenaline starts going and they may start screaming or, will you stop chewing?
Yep.
So, anyway, there you go.
That's no good. Hey, and Darth's got one.
Yep. What you got?
Darth's got one wanting to know if raw honey really does help with allergies.
If who?
Raw honey.
Oh.
I thought you said raw honey.
Oh, I apologize.
I thought you said rawhide.
Rawhide. Who's that? That reminds me of a song. Anyway.
It was a TV show.
Yes. Well, it's also in Blues Brothers, when they're doing the song Rawhide.
Okay. Which was the theme song of the TV show, wasn't it? I think
probably
so.
Anyway, probably. Anyway, but no, he was asking if raw, local raw honey,
right?
Not rawhide, local raw honey does actually have a benefit.
So I used to believe
allergies,
this.
Yes.
So if you had, say, ragweed or something like that if the bees got honey or nectar from the leaf or from the flowers,
right.
that would give you sort of a sensitization if you ate the honey, and you would form blocking antibodies just as if you had allergy shots. And it turns out that it's bullshit because you usually are not, number one, they're picking up nectar. They do pick up some pollen, but that doesn't really end up in the honey so much. That they,
that's filtered out a little
that's
bit.
the trick that the flowers use. They offer the bees nectar so that the pollen will go from one flower to another and fertilize them. But they usually pick up pollen from really brightly colored flowers, and those rarely cause allergies. And then if you eat unprocessed honey, it can cause serious reactions, including hives and stuff if you're allergic to what's in it. And on top of that, it's better to just have processed honey, in my opinion, although the people who raise bees may disagree. Now, there have been studies that show that daily honey eating, in addition to taking allergy medicine, is associated with less allergy symptoms. But eating locally collected honey had no effect on the allergy symptoms of those versus those that didn't. So it's if you have severe allergies, they recommend that you don't eat honey at all. Even trace levels of allergens can cause major reactions. So you got to know, you got to know what you're eating and what you're allergic to. I mean, you can try it, but if it makes you worse, you got to stop.
Well, I think as far as else, but there's some medical uses for honey.
Oh, absolutely.
Being antibacterial, antimicrobial, but not so much and anti-inflammatory. But not so
they
much
use it in wound care,
right? But not so much for taking it orally and helping you with your allergies. But it can be used for a lot of other things, like nasal sprays with honey in it to block those pollens. Yeah.
Correct. Okay.
Anti-inflammatory, yes.
If you have, you can have a bell.
Yes.
All right.
Sucker.
If you have a sore throat, there's some data that says that it may help, particularly if the sore throat's caused by postnasal drip. It's just wearing away the mucous membrane back there. Do not give honey to children under a year old. There's some raw, unfiltered bacteria in there, including botulism, that kids can get from raw unfiltered honey because their immune system is not yet ready to handle that. So, okay.
Belle,
Okay, got it. That was done. All right, next. You got another one from in there?
I don't think.
Okay. All right. Well, let's do some phone calls then.
Number one thing, don't take advice from some asshole on the radio.
All right, I will not.
Boy, Dr. Steve.
Good morning.
Me and my old lady have been getting...
You talking about your grandmother?
That's such a sweet way to refer to your wife.
It is, isn't it?
Well, I'm an old lady, I tell you that. Well, okay, anyway. All right. Sorry.
I've been getting it on.
Oh.
Like, a lot since we've been locked up together. We wait until the children are asleep, of course.
Of course.
And I just wanted to let you guys know that I've been shooting like I was 22 again. Like, I
Okay.
pull it out, and it's just... She has to cover her face. I'm literally shooting 2 feet. It's freaking amazing.
Get your hand off my penis!
So I'm edging like I'm Jim Norton over here, and then exploding like freaking Peter North. I didn't have a question. Just wanted to let you know.
You just
that's
wanted to
nice.
brag.
That is
Yes.
all.
Well, I think that was a 2020 question, too.
Yes,
They said they were
I
locked
believe
up
so.
together.
COVID, yeah.
And, yeah, good. Well,
He probably has.
all right. He's shooting rope, so
Congratulations.
good for him.
Eat more honey.
Yeah, he just called to brag. There's nothing wrong with that. You can call to brag. All right, let's see here.
Dr. Steve, I don't exactly have a question, more so a way to...
Okay, so, we've only been doing this show for 20-some years. You ask questions, we answer them, but it's okay. You can call with anything you want. It's free country.
help you out a little bit, perhaps. So
Okay, thanks, man.
we say that
I need help.
you kind of kick yourself when somebody asks a question and you say, that's a great question,
Well, okay, yes, correct.
because, hey, when other people say that, but yet you like to say that all the time. So I figured maybe instead of saying, that's an excellent question, you could just kind of change it up and say something like, oh, I like that question, or I really love that question, or that's an exciting question, or I'm glad you asked that question.
Okay, I get it. I'm glad you called. I really enjoy your statement and your instructions to me. Thank you. I really appreciate this statement that he's making.
Or I can't wait to answer this question. Or
I can't wait to try this out when we actually get a question.
or let's see, hell of a question, et cetera, et cetera, et
I
cetera.
like
Maybe
that
that'll
one.
kind of
Yeah, that's a hell of a
That's
damn
a hell of a question,
damn
brother.
idea.
That's a hell of a
get
question.
you out of that little internal conflict that you have.
Thank you,
when
sir.
somebody calls in
Now
and actually
I get in ruts where if you look at the Eclipse video
That's
that we
hilarious.
did in Dallas where Dave burned his eyes out, spoiler alert, that's me yelling, amazing. I think I say it 3 times in the 1-minute video. So I've got to learn to sort of vary things up, change things up a little bit.
He does ask a great question. Okay, keep it up, man. Love the show. See you.
Thanks, buddy. I do appreciate it. It's a good idea. I need to do better. All right. Let's see here.
Hey, Dr. Steve, Dr. Scott.
Hey.
You guys are doing a great job. I really enjoyed the speeded up comments.
Thank you, sir.
So do
I
we.
still think for Tasty to enjoy it, you need to get like one of those bells like they used to in and around a boxing where she can really...
Okay. What I ought to do is
I agree.
I'll give you a Stream Deck that has a single button on it, and it's got the bell, and you can do it for the beginning, and then I have 2 buttons. You can do the boxing bell for the beginning of the 3 minutes, and then I'll have you a buzzer for the. And actually, you can set a timer on these things on the Stream Deck. It's cool. I'll get you one. We'll see how that works. Okay.
They're apart. So anyway, I'm going to go out on a high note.
Okay.
Donate my body to medical science, local university.
Yes, sir.
Now, when I do that, do they go in and see what organs are good for donation, or
No, this is a different thing. But go ahead.
or do they just send the body on over to their morgue awaiting the students? I was unaware exactly how that worked.
It depends on what you're signing up for. So,
Are we beginning the 3 minutes now?
sure, yes, please.
Okay.
You ready? Can I start now?
3,
Yes,
2,
now
okay,
you
go.
may. You may.
Okay. So it depends on what you're signing up for. There are places like Restore Life USA where you sign up for for body donation, and they specifically say we're going to use body parts for medical research, which means if they need cartilage from a knee, they're going to remove the cartilage from your knee. If they need pancreas cells, they'll remove pancreas cells, and then they will cremate you and give you back within 30 days. If you sign up to go to a medical school, this is not organ donation. What this is body donation, and they're going to do pretty much whatever they want to. Now, you can ask them, what am I signing up for? I mean, you should do that. A lot of times they're sticking you in a vat of formaldehyde, and then they take you out and you are assigned to a group of 2 to 4 medical students who will then learn anatomy using your body. When I did mine, my body had a stomach full of pills, and he had obviously killed himself. That was not what was on his death certificate.
Oh, my goodness.
So I went to my professor and I said, should we let somebody know? And he said, hell no. Some little old lady already got her, her insurance payment for this guy dying from a myocardial infarction, which was what was on his death certificate, and you're going to screw it all up. So just keep your mouth shut. It was 2 years ago. So, we just let it go. But anyway, that was wild.
That is crazy.
Yeah, just full of pills. Full of pills.
Goodness sakes.
Now, they could have been, coated aspirin or something that just kind of blew up in his stomach. Maybe he was having an MI, and he just kept taking more and more aspirin because he had dementia or whatever. But whatever, he had a stomach full of pills, and we just kept our mouth shut. All right? So ask. How'd we do, Tace?
1 minute, 1 second.
Okay, well, Scott, you got something you want to add about it? About donating, your body to science?
Well, I think there's a bunch of different ways, and I think that it's certainly helpful to all of us. Like we've got the Tennessee Body Farm where they put.
Yeah, you can do that. Just throw you on the ground and see what happens to you.
I personally think there are a lot of better options than just being chunked in the cold ground, as John Prine says. Chop me up and pass me around.
Yeah, I like the idea of
That's
making ink.
Yeah.
Compressing it into a diamond.
Yes.
Shaking like a
Or
diamond.
a tattoo.
So anyway.
Possibly, yeah.
Very good.
Cool, man.
All right, let's
That's a
do
good
the next
question.
one.
That was a good question.
Well, it's very good.
Dr. Steve, if you had unlimited funds to for a clinical study or trial, what area of health or science would you focus on? In other words, what could today's society benefit from the most? Just curious about your opinion.
Oh, boy, that's a tough one. There's the serious answer, which is, the two frontiers of science, or medical science right now are the neurologic system and the immune system.
Right.
And people go, well, what about cancer? Well, that is an immune system problem. That's a problem of surveillance of the immune system where the tumor is allowed to grow without the immune system recognizing it as foreign and not killing it.
Right.
So that's one. And then the nervous system, we don't know how it works. So I would probably, if I had unlimited funds, because there's lots of funds being put toward cancer right now, I would put it toward understanding consciousness, because when we understand it finally, then we can fix it when it doesn't work right. Just dumping loads of serotonin into a depressed person's brain, we've talked about this multiple times, isn't cutting it.
Yeah.
So,
and dementias and Alzheimer's.
Yeah.
And Huntington's.
When the brain doesn't work right, we don't know how to fix it.
Spinal cord injuries.
Yeah.
That whole neurological thing from the.
So I would invest
brain,
on fixing the neurologic system and understanding consciousness.
Because don't you think the cancer research, as far as the immunology, they're making some progress.
They know what the problem is.
They're getting there.
It's just a matter of
figuring out
how to do it. Right now, we still have no clue.
No.
What the fuck consciousness is.
No. And I'm pretty sure we won't.
Well, maybe we won't. It might be like
For a
Gödel's
while, yes.
incompleteness theorem, that it's something that a conscious brain can't understand consciousness, but we ought to be able to understand the mechanism of it. So that's that. And then the silly answer is, I would just do research on, how fast does water drip out of a pipette, and then take the unlimited funds and go on a cruise for the rest of my life. All right? I would abscond with the money. In other words.